My first case presentation is on trap pregnancy. Trap pregnancy also stands for twin reversed arterial perfusion. Trap pregnancy affects identical twins who share a placenta. One of the twins has a heart that doesn't form correctly and receives blood via the normally developing twin through a vascular anastomosis within the placenta. Trap is an abnormal communication between the blood vessels and fetal circulation of both twins. The twin without a heart rate is termed acardiac or trap twin. Trap occurs in 1 out of 100 monochorionic pregnancies, and it has a very poor prognosis. Equipment used for these scans was a GE Voluson 10 and the transvaginal transducer. Patient history: a 25-year-old female, first pregnancy. Her last period was May 24th of 2023. Estimated due date was March 6, 2024, based on her last menstrual period. Other patient history: she takes metformin for insulin resistance. Unfortunately, we never drew labs on her, so I don't have her HCG levels. Previous imaging: so she came in for a transvaginal ultrasound around her 8-week mark. This would be her new OB appointment, where she also received instructions and prenatal vitamins. The baby's heart rate measured 132 beats per minute at her first ultrasound. A single fetal pole was seen with cardiac activity. A yolk sac was visualized. A possible chorionic bump was noted in the report. Her cervical length was 3.3 centimeters. There were no abnormalities with her ovaries or in both adnexas. So she came back in around 12 weeks for a recheck due to this possible chorionic bump. So we first see a normal appearing fetus as far as gestational age goes, but there was this strange connection. We weren't sure what it was, so we went ahead and measured this baby. This is fetus A, who was measured on the 8-week scan, and we measured it around 11 weeks and 1 day with the crown rump length. So fetus A, the previously measured fetus, heart rate was 177 beats per minute. Crown rump length equals 11 weeks and 1 day, which is just a week behind her estimated gestational age based on her period. Growth appears within normal limits. This is another picture of baby A, and this is what the first tech who scanned her noted as the possible chorionic bump. Here's another picture of fetus A, and you can just see this connection. That's obviously something is not right there. So here's an image of fetus B. We scanned out and could see it more clearly. You can see the spine here. This is the head and the bottom. A second fetal pole was seen inside the same gestational sac as fetus A. When we measured it, we did a crown rump length and it came out to 9 weeks. We saw no cardiac activity present. Blood flow from baby A was feeding directly to baby B from the placenta. fetus B was believed to be what was labeled as the possible chorionic bump at the patient's 8-week scan. This is another image of fetus B. You can see the yolk sac in this picture, and we just did a crown rump length from the head to what we thought was the bottom. The fetus was obviously starting to not form correctly. When we measured, that came out to be around 9 weeks, which is 3 weeks behind fetus A's measurement. So as far as the report goes, fetus A, we saw normal appearing growth and heart rate based on her last period. Fetus B obviously was misshapen, and we saw no fetal heart tones. And even with color Doppler, we did not see any kind of flash. The patient was referred to maternal fetal medicine, and unfortunately we have not received that report from the MFM.